Hi, good morning, everyone, or good afternoon, depending upon where you're located. We'll be starting the webinar in just a few minutes. Share my screen. Looks like a lot of people are signing in right now, so why don't we give it one more minute and then we'll go ahead and get started. Hi, everyone. If you've recently signed in, we're going to get started here in about 30 seconds or so. We have a lot of people signing in right now, so we want to give just a little bit of time to allow everyone that wanted to join to be able to get signed in. Okay, well, the numbers are still growing, but we're a couple minutes after the top of the hour, so I'm going to go ahead and get us started. First of all, welcome everyone. We're glad that you're able to join us today. We're excited to share with you the positive impacts that transforming charge reconciliation through automation has had for Crisp Regional Hospital. Before we get started, I did want to address one quick housekeeping item, and that is that during the discussion today, your microphone will be muted. We do want to hear from you, though, in the form of questions, and I'll go over that in just a minute of how you can submit questions as we're discussing today. I'm going to go ahead now and move on and introduce our special guest and other panelists today. So we're excited to have Jessica Carter join us this morning. Jessica is the CFO at Crisp Regional Hospital, where she's dedicated nearly 30 years of service. She oversees revenue cycle management, ensuring the hospital's financial stability and efficiency. Jessica has extensive experience in leadership in healthcare finance. Crisp Regional Hospital is located in Cordell, Georgia, which is a little south of Atlanta, has 65 beds, and uses the Oracle CommunityWorks EMR solution. Joining us today also is Charlie Thompson. Charlie is a sales engineer with Streamline Health. Charlie also has experience working on the hospital side of the fence in IT roles. So he brings a good balance of expertise to the conversation. Stella Street is our Director of Business Development, and she will also help facilitate our conversation today. I serve as our partnership leader and work closely with EMR organizations such as Oracle Health. Today's format will be conversational, in which Jessica will share Crisp's journey of transformational reconciliation through automation and the positive outcomes that they have realized. We'll also provide a brief high-level view of the automation software that they're using called RevID. Please note on the side of the screen, the right side of the screen, that you can post your questions by clicking on the Q&A icon at the top of the Teams page. We'll save time at the end to address your questions that you have. Now, before we start our conversation with Jessica, we're going to post a polling question to get your thoughts on what you think is important for a high-performing charge reconciliation process. So Tufel, if you can post that now, that will be in the chat. So if you click on the chat at the top of your screen, you should be able to open up the chat window and allow you to answer the polling question. And Tufel, I cannot see how the responses are coming in at this point. But if you answered all of the above, then you're correct. Charge reconciliation, like other critical revenue cycle processes, has many moving parts and participants that all need to be efficiently synced and managed to achieve optimal results. So with that, I'm going to stop sharing my screen. Oh, got the polling question. And I'm going to bring in Jessica now. Good afternoon, Jessica.
Good afternoon. Thank you for having me today.
Yeah, well, I appreciate your willingness to participate today. To start our conversation today, Jessica, I was hoping we could go back in time a little bit and prior to when you started using the automation software and tell us a little bit about what your charge reconciliation process was like at that time and perhaps some of the challenges that you were experiencing.
Okay. We did have a charge reconciliation process. When we went to Cerner about 5 years ago, we did create a process that managers had to work through because we understand the importance of charge capture. It probably was not the best because it was manual. It was hard to keep people accountable to that process. It's also very time consuming for our managers, and we weren't really sure they were doing daily reconciliations. We had created, when we first went live with Cerner, we did dailies for a long time, just to make sure that the system was built right and things like that. And we maintained that. But then we went to managers had to turn in something weekly to do that. And, some were good with it, some were not. It was very a manual process to see were people doing what they thought was a true reconciliation, which you're not going to be able to do all that in a manual process like you could in automation. So that's a little bit about where we were with very manual reports out of DA2 and things like that with the managers to reconcile that on a hopefully a daily basis, but more likely a lot of times it was weekly with some of our managers.
So did you have somebody, Jessica, that was working directly for you that was trying to manage this whole process? And tell me about how that went.
Yeah, we have a revenue integrity director who was, ultimately responsible for working with the managers to make sure that these were done daily, working with them when they did find things, because you do find things that, something is not generating a charge. And so they would work through that. But, it was, again, a very manual process. And as you all know, some of your departments have lots and lots of volume, like pharmacy and lab. And, those can be overwhelming for them to manage and know, are they really getting the charges in like they should? So, she was having to do that along with all of her other responsibilities, helping those managers try and keep up with their charges daily. So it was, sometimes it was probably inconsistent and sometimes probably not as accurate as it could have been with the manual process.
Yeah, and so was each department then, were they provided something that they, like a charges sheet or a posted charges, and they would try to reconcile that with a scheduling sheet or maybe a little bit?
Yeah, we had worked when we went live to find out what report every department needed to run daily to be able to know what their charges were. And then, they would have to look at that and see, do they correlate? So for every department, it could have been a different type of report. They were responsible for running those reports and making sure that that was done. And that, sometimes happened and sometimes did not. And we really didn't have any type of visibility to know if they really were doing it or not. We, just that they said that they did. And, sometimes clinical people think that they're doing something and they are doing a process, but they have lost maybe the true functionality or the purpose of it, and they're not actually accomplishing the task that they should be accomplishing. So it became tedious and cumbersome for some of our managers. time consuming, away from other things that, and as we all know, we all wear multiple hats. And so it just was eating up too much of their time.
Yeah, I can certainly understand how that manual process, trying to match things up, especially as you said before, in the high volume areas, it can be very time consuming and distracting from the work that they're really focused on trying to get done. Um, in terms of kind of, was the organization at this point recognizing that you needed to do something different in this space, and figure out a way to help them to improve performance? Or tell me a little bit about kind of how you started to grapple with what are we going to change, how are we going to change, and that sort of
Well,
thing.
when people that work with me will tell you I'm always looking at how we can look for something to do something better, more efficient, more effective. And, I knew long term, if we were going to be successful in charge capture, we needed to look for a solution that maybe could automate or help our teams in that. And so, just was out there looking for it. We are a community works provider with Cerner. And so, some products work, some products, are able to interface. And so, was super excited when I was at a Region 5 Georgia FHMA conference,
Hmm.
and was talking to vendors. And that's really how I found the solution, and was ecstatic, to be honest, when I heard, it would work with Community Works and all like that, because I knew that we needed automation to be successful going forward. And so, I mean, that's really how it happens. I'm always out there looking for things that, that is going to work. It's going to be efficient and effective, and, again, bring a return on investment. And that's kind of how we found you.
Yeah, yeah. Um, and then you had to bring that idea into your organization and start to kind of engage others in the organization around the concept and the solution and all. What was the process internally in that, and what was the receptivity that you were getting from the organization? And
We took it in. First, I brought it in like with my revenue cycle, my revenue integrity director and all. We looked at that, and we brought in or Cerner Oracle and y'all to work through that. Then we have an IT governance committee in which all things get taken to. One, to see, is it something that the organization wants to do? The other piece is also to make sure that IT has the resources to implement what you're, want to bring to life in your part of the world of the organization. So we took it to, once revenue cycle went through it and vetted it and said, this is a product we really want, we took it to that IT governance, which is made up of IT, senior admin people, clinical people, and all like that. When my clinical team saw that, they're all like, we want it. They instantly saw the value and what they were going to be able to give back to some of their managers, because it is easy to use, it is simple to use, and IT, you'll find there is not a large lift from IT, so it doesn't require a lot of work from your IT team. Streamline and Oracle do a lot of that in the background. So it's a pretty easy project or a system to implement for an organization, because you're not asking for a lot of things, because IT gets pulled a lot of different ways, and they were able to put this on pretty quickly, because it didn't demand a lot from them. So obviously once I went through IT, then we went to finance and all like that. But it was great acceptance from the very beginning when they saw it. They saw the value in it, and what they were going to be able to get back. So.
very good. So kind of intuitively, they recognized that the opportunity to really provide a way for them to more efficiently identify where there's mischarges would be far more effective in their approach to doing the reconciliation work. Talk a little bit about some of the training. I know you mentioned ease of use. Did the training process go smoothly? Was the adoption rate, was that a good result in terms of how the product was received in the organization?
The revenue integrity director did a lot of the training with Streamline, but I mean, I think the training went well. We brought our hospital on first, for inpatient and outpatient. And then a couple of months later, we brought on our physician practices because we do billing for about 80 different providers. And so we've brought that on to help with that daily reconciliation from all of our clinics and physician, hospitalists, all those kinds of, ER docs, all that kind of stuff to help with those reconciliation. And so it was, it was easy to use. You work by exception. And so you get a red light, yellow light, green light, and, so they're able to know which things to work on. So, they were able to do it. You work through, because you're going to do it like off orders and things like that. So you work through, okay, this order shouldn't trigger a charge, so you really you work with Streamline to make sure that it is triggering an event. And so you've got to walk through some of those things, but still it's not that big of a deal, but you've got to walk through it. So when they look at it, they really are looking at good, information. You don't want them having to look at red things that really shouldn't have a charge on them and things like that. So, it's been very well received by our clinical side of the house. And for my revenue cycle integrity director, it has allowed her to be able to do charge reconciliation much faster. It allows her to do other things because she has other responsibilities and things like that. The other thing I'll talk about is some of the other intangibles that you will get out of this. You're going to see that you're able to see things a lot faster. Sometimes charges get on wrong encounters. And so when they're doing that daily reconciliation, they're like, okay, the charge is there. Well, the charge is there, but it's on the wrong encounter. It could be on a pre-admit, things like that. And so sometimes it would be months before we would find those charges. The charge was there, it's just never going to drop to a bill because it's sitting on a pre-encounter. So we're able to catch those things the next day as opposed to weeks or months later. And sometimes that can be lost charges, not, late charges, lost because you've missed the timing for billing that. It helped with suspended charges with us catching those faster. It helped with, sometimes you find things aren't routing to the right GL. It helps us catch those much faster. We have a lot of our managers, we are on productivity. So those charges matter to those department managers because they need the charge to go to their GL to get credit for their productivity. So it helps us make sure that we are getting those charges to the right place. So, there was more than just the reconciliation, which is huge, but there's other things that help you be much more efficient in your revenue cycle process.
Very good. Yes, the intangibles. Some of the tangible items as well, you spoke to there a little bit earlier. I'm wondering, what would the staff say in terms of the time they're spending now versus the time they were spending before in doing reconciliation?
They spend minutes, as opposed to when they might have been spending over an hour trying to run something down. So, they might can do it, 10 minutes, they're able to go in there. If they don't have anything, then it, they don't have to do anything if they're all green. And, the system does reports. It also allows, like, for your revenue integrity director, whoever has that responsibility, they can go in and instantly see who has not signed off. So who has not signed off, how many days they haven't signed off on. And, if they don't fix it, it keeps showing up. It's not like it's one day and gone, that item still is there, but it gives easy insight as to who is doing their reconciliation and who's not. And, then you're able to hold people more accountable with the process. You can automate it. We have a report that comes to us and tells us who hadn't signed off in so many days, and it goes out, and people usually don't like being on those kinds of lists. So, you can help people be more accountable and make it part of their daily routine. One thing we did have to learn was sometimes we had started doing it earlier in the day, but because sometimes Cerner was not hadn't processed all the files and sent to Streamline to be able to do that, we had to work out what was the right time to be able to tell managers they could go in and do that. But I think we've kind of worked through that. We were starting earlier, and we just decided anyway, sometimes our things weren't being finished at Cerner to be able to pass to Streamline. And so we've told them a little bit later in the morning to be able to do those daily reconciliations. But I mean, everybody's domain and system would be a little bit different on that. But that was one of the things we kind of had to work out, because some were coming in first thing in the morning and doing them, but the files hadn't finished processing. And so, you know, those are just little housekeeping things you have to kind of learn based off your own facility. But they love it. So
That's wonderful to hear. You know, I know that you all do a lot of work with our client success team on a monthly basis, and review those reports together, and really build more and more intelligence into the system so that it is identifying for you those charges at the appropriate time that they should be found and identified as potentially missing. Can you talk a little bit about kind of that client service experience, and how has that been helpful for you and your team?
Yes, absolutely. I mean, there are monthly calls that help you do it. I can tell you, as we implemented this product, y'all were there with us all the way through, you know, as we were trying to make it more efficient and effective. Streamline was very helpful in working through that, you know, working through the trainings, working through tweaking it so that it is producing accurate information, like those orders, you know. And there's things like you can do in the pharmacy and the labs, you know, like, and that's actually, I was just working on something this morning with my billing office, and it's like, it's some pharmacy stuff that's holding up. And I'm like, why is that still out there? And I'm like, hey, let's see if we can't build something in Streamline to catch it daily, as opposed to my claim editor catching it later. You know, it had to do with some duplications. And so, or how many the multipliers. So it, you know, you're able to look at stuff a little bit more upstream before it gets there, because it just allows you to fix things faster. And so we're still learning ways that we may be able to optimize it, because that's my thing, is as soon as I can catch it, the better, the faster it goes through. You know, you get your claims out faster. You're just not finding things. I mean, it helped us in a lot of areas besides charge reconciliation. But the monthly meetings, they go through that. They help you ongoing. You know, I've actually, in the process, I had somebody who was here with me when we implemented it, and she had to go do other things due to family. And so I'm in the process of training a new revenue integrity director who's had experience but not exposure to this. And she's like, this is really great. And so she's very easily able to learn the program and what the value and how to do it. I mean, she's only been with me a couple of weeks, and she's been able to, you know, jump right in and be able to pick up that tool.
Wonderful.
That's so.
Jessica, we have a few questions that came through. I was hoping that we could address. The first one is, it's actually 3 questions, but if your clinical operations team felt the manual process was a burden, how has this tool alleviated the workflow from them? Who reviews the missing charges or accounts that populate? And if that's your clinical teams, wouldn't this tool just replace work they were doing before?
Well, they are the ones reviewing it, but it shows up. It's only going to be the exception. So you build the system so it knows, I ordered this, I'm supposed to have this charge. If that's there, it's green. But if it's not there, then it's either yellow or red based off the issue, and they have to go in there and fix it. Before, they may or may not have been fixing that. So you may not have been capturing that revenue because they were just doing a daily reconciliation and they may have looked at it. So let's use, I put the charges on the wrong encounter. Let's say I put the charges on a pre-admit. Okay, when they did their daily reconciliation, it may say, oh yeah, I got that charge, there it is. Well, it was on the same patient, registered for another day. That charge is never going to drop. RevID is going to know, I had this come in, there was an order, there's no charge. So it's like, it's not on the right encounter. So you need to get it moved to the right encounter and things like that. So before, they may have been doing a reconciliation, but they were not capturing it. We did see an increase in our charges almost immediately when we went live with RevID. We saw an increase in lights on. So that average daily revenue went up. We're, expecting to get over $1 million in the next year in additional charges or reimbursement due to charges on there. So you're assuming that everybody's doing everything correctly on the manual process, and they're not.
Well,
was that all? So I realized in the middle of this, my camera had gone off, so I was trying to cut it on. So I may have missed
You're good. You're good.
Yes, and just a continuation of that really quick. For those that have areas that have never reviewed their charges or charge reconciliation before, how did you teach them? And ultimately, how did you teach them what to look for and how to fix it?
That was a long process. But, some of it is depending on what it is. Some of it is they just didn't drop the charge, or some of it could be on the old one. So some of it you just work with them based off the issue. But we went through and we talked to them about the importance. That was something culturally that we set from a senior admin team, that charge capture is important. It's important. I still live in a cost of charge world for some of my payers. So it's very important for me to capture them. For your cost report, it's important for you to capture these charges. So, we built a culture around, it's important that we do this and get this right. But this would be a much easier tool to teach them how to charge capture, because it's going to be right there in front of them. If they don't know how to fix it, then they would work with your revenue integrity director to try and fix it. You may find, you thought you were charging for something and you're not, because that order is not dropping the charge that you thought it was dropping. And, I just think it automates it and makes it extremely easy. And I think y'all are going to do a quick demo later, and that may show you a little bit how this really, I would have done this sooner had I had knowledge of this product, because it makes it so much easier, especially for clinical people who don't always understand what you're asking them to do. It was a lot of hand holding at the very beginning on the manual process. The automation, I can teach a new person pretty quickly how to do those charges.
Great. Thanks, Jessica. Stella, anything else before we?
Yes, we have one more. So
Sure.
How long, Jessica, are you giving them to review and correct? This question is saying that they imagine pre-billing could bottleneck revenue if they aren't compliant. Did you face any of that?
No, well, I expect daily reconciliation. That doesn't mean it happens. We have a 5-day hold. I know a lot of people have a 3-day hold. We do 5 days, because I'm kind of like, 2 days isn't going to kill me. But you have a report that will tell you on a daily basis who has and who has not signed off. And we really didn't experience anything like that. I mean, when you say the pre-bill, I didn't have any issues with that. I can tell you, I did, while I'm here, we saw it so far, and I think there'll be more. We're experiencing about a 30% reduction in our late charges. And, that deals with rebilling and things like that. To me, that's a big win too. You still are going to have your doctors and some of them who don't always do like they're supposed to do, but we can work on that another day. But we didn't, and I may not have understood the question, or I may not have answered it. And if I didn't, please rephrase it or ask it again, and I'll try and answer your question. But we didn't have any problems with that.
Great. We have a few more questions that are coming through, but we will save those in the interest of time. We can just keep the conversation going.
Yeah, why don't we do that? Thanks, Stella. And thank you, everyone, for submitting your questions. Please continue to do that. We are going to take a moment right now to take a quick look, high-level view of the automation software called RevID, so that you can kind of get a sense of some of the things that Jessica's speaking to, and some of the detail elements there. So we're going to transition to that in just a minute, but I did want to suggest, though, that those impacts that RevID has had that Jessica has spoken to so well are consistent with all of our other RevID clients. They're recognizing improved revenue performance. They're seeing a reduction in late charges, reduction in rebilling activities, saving literally hundreds of hours of managerial and staff time in the reconciliation process, and really embracing that enterprise-wide accountability for daily reconciliation work. So with that, Charlie, why don't you go ahead and share your screen, and you can provide a high level, and then we'll come back to more Q&A in just a minute.
Yeah, absolutely. Thank you, Hal. Thank you, Jessica. So this is going to be an extremely high-level brief overview of RevID. And so I just want to walk you through first kind of the workflow. So what you're seeing on your screen now is where kind of RevID sits. And I want to highlight some of the things that Jessica had mentioned, the problems that RevID solved. And as I do that, I want you to think, how do I currently solve this problem today? And then what does this solution look like to solve my problem? I want you to be thinking that as you're looking at the solution at a high level, to really compare and contrast how you solve, reconciliation and some of the other issues that Jessica had mentioned. So what RevID really solves is the time-consuming manual process. And Jessica, I think, really highlighted the key focus of RevID, and the power behind RevID is that it's only presenting to you the exceptions that need to be looked at. One of the root causes of the time-consuming manual process is you're looking at the bulk of your charges that did reconcile. And so that takes a lot of time. And what RevID really highlights, although you can look at the ones in RevID if you would like, of the ones that did reconcile, the true power of RevID is it highlights the exceptions. And so where RevID sits is it is looking every single day at the charge file matched up with your clinical events. And so for inpatient folks, it's doing that every single day while the patient's still in house. And for outpatient, as soon as the patient is discharged outpatient wise, it's going to be looking at that information that night. So the next day you're going to be presented with those exceptions. And so just to give you an idea of what that looks like, really quick, I pull up my demo system here. It might have signed me out, so I'll sign back in real quick. And so the first thing when you log in is you're going to see what's called an average daily revenue. And as Jessica mentioned, we use the stoplight colors, so red, green, and yellow. And I want to show you here, this is for one facility, that you're looking at your departments. And right away, you can see on your average daily revenue what sticks out. I'm going to focus here for the sake of time on the infusion. As you can see right here, it was minus 47% of expected revenue. And we can tell on the right-hand column here that we still have 28 clinical events that do not have charges. And so for the person responsible for reconciling charges in the infusion clinic, for your director of revenue integrity or whoever is going to be responsible for managing this solution, they can tell right away that we have some exceptions that need to be looked at. And so I can click right into my infusion clinic. I apologize, going to sign back in real quick. I can sign into my infusion clinic and I can see right here in chemotherapy, this is where the issue that we're having. And so if I click into chemotherapy, right away, what's going to be presented to me are all the exceptions. You'll see here that I have 28 charges that need to be reconciled. The information for that is going to be located on this card for you. And just to show you how easy this workflow is, as Jessica had mentioned, it completely takes away the manual process, and this is completely automated for your teams, is that with just a click of the mouse, a couple clicks of the mouse, I'm able to review this encounter that has a missing charge, and I'm able to assign that to the person responsible for correcting that missing charge. And of course, I can put in a subject here, testing charge. I can change the priority of this. This is a high priority for this person, and I can add comments if I want to as well. And I'm going to go ahead and assign it to myself so I can show you the process once I save that. Select a task category. It's a missing charge. And so once I save that, it's automatically going to assign that accounter to the person responsible for that. So what that looks like when the person responsible for correcting that charge, when they sign in, they can go into their task screen and they can see the tasks that are assigned to them. Once they see the tasks that are assigned to them, these are the ones they know that the charge needs to be corrected. And so they can click into this task and see the information of this. And they're able to, once they resolve that charge, they're able to change that status to resolved and then click update. Once that is updated in RevID, that is going to help them attest to the fact that they have completed their charge reconciliation for their department. Jessica had mentioned we don't currently have time to go over the reports, but Jessica had mentioned that RevID has tons of reports. It's very intuitive for your data, and it also is going to show you who is signing off and who is not. So it gives you insight into some of the issues that Jessica had mentioned, which is, do we know whether or not they're doing reconciliation? If they are they doing it as expected? So it adds that accountability element to charge reconciliation and allows you to actually manage the system. So that's an extremely brief, high-level overview of the ease of the workflow and how RevID presents your data to you by exception-based, eliminates the wasted time on charges that already reconcile, and allows you to actually know who is doing those charge reconciliations and who is not.
Great, thank you, Charlie. Why don't we turn now to the question and answer portion of this. Stella, do we have more questions?
We sure do. Someone asked if this can be used with third-party billing.
Yeah, Charlie, do you want to speak to that, or?
Yeah, I can speak to that. So I believe this question came from Jessica. I believe you're meaning with other systems besides your EMR. And yes, RevID is agnostic when it comes to that. So we're able to pull in, let's say you have a different system for your PACS for imaging that drops charges. Maybe you have a different system for your pharmacy that's integrated as well. So we can take those third-party systems and integrate that into RevID as well. That's a great question.
Great. And then let's see, for those areas with large volume like pharmacy and lab, is the expectation that they review all exceptions every day as well, or is their process different from other areas?
Nope. Their process is to do it every day. And, you know, the thing that you'll learn is sometimes you find things are built wrong or you need to tweak things. So you're able to work through problems. So maybe, you know, they don't get, you know, where they do become manageable. You sit down and you kind of work through those. Are there things that we can write so that the exceptions are true exceptions, not things that they really need to be looking at? But I mean, they need to do it daily. That's my expectation.
Great. All right, next question. When you make the correction in RevID, does it flow to the system to make the corrections on the charges?
Y'all want me to answer that one, or would y'all like to?
You want to explain how you do it, Jessica? And Charlie, you can.
It does not flow back. It does not currently flow back into Cerner. You have to go in and fix that in Cerner. But if somebody said they fixed it and they really didn't fix it, it's going to show up tomorrow. So just because they said they did something in RevID, it doesn't. They have to fix it in Cerner. Otherwise, it's going to come back to them tomorrow to work again. So there is, you know, it does not go back in, but it, you know, if they don't fix it, it does show up the next day.
And I'll add to that and say that once you do make that correction, it automatically does flow back to RevID so that it will be reconciled and it'll move to the green so that it won't be in the exceptions anymore. If it's not corrected, as Jessica highlighted, it's going to continue to show up in the red or the yellow. So if you attest to it in RevID, it will move to a yellow. But if that is not corrected in Oracle, as Jessica mentioned, or your EMR, whatever EMR you use, then RevID is going to highlight that again. And so it's going to show up again in RevID as saying, hey, this one's not reconciled.
Great. Thank you, Jessica and Charlie. The next question is, what was the impact on your revenue cycle work queues? Did your staff continue to work those queues since most of the errors could be caught in this system as well?
Yeah, you still work in revenue cycle. I mean, because you're going to have other kinds of issues, but the things that go in there should be less. I mean, your late charges, I mean, some of the reworks, things like that. But yeah, you'll still be in rev cycle working.
All right,
Jessica,
great.
do you happen to know how much your late charges were reduced or rebilling? What percentage are rebilling
Yeah,
would be
but we're experiencing about a 35% reduction in late charges. And so I don't have the rebuild number, but obviously it's going to follow something like that. But y'all all know rework and all those are difficult. And like I talked about before, when a charge is on a pre-encounter, before we weren't catching that. Well, okay, we may find that charge a year later. Well, for some of my payers, I just lost that revenue, you know. So those kinds of things you're able to catch so much sooner too.
All right, another question just came through. There are some charge corrections that they can't correct. They have to be done by rev cycle. Can these corrections flow to a work queue to be worked by the revenue cycle?
I don't.
Yes.
Okay. Yes.
Yeah.
Yes.
Go ahead, Charlie.
Yeah. So I can answer that one. Yes, they can. So not only does RevID match your clinical events with your charges, but RevID also has rules based in the product as well. So as Jessica mentioned earlier, she works with the client success program. When they find different opportunities, we're able to create rules in RevID so that you're able to highlight those exceptions. And so that's no different. If you have particular ones that need corrected by rev cycle, then your clinical staff, if they're the ones managing their department, they're able to assign that task to someone in rev cycle, or RevID can actually have rules built in to where you automatically filter those to someone that needs to work that. So great question.
Other questions, Stella?
That's all for now.
One thing we didn't talk about was maybe the timeline. I mean, I think we had this up and running in 3 months. I think that's somewhere in that time frame. So it was a very quick implementation. So RevID, Streamline, and you know, for us, Oracle picked up the heavy lift on all that. And to me, that's a very fast timeline that we were able to start seeing results on this. So, I mean, I was trying to think what else we might not have talked about, but for
Well, I
those
can
of
ask Jessica real quick. So one of the other things that comes up in the different EMRs have different things going on, but I know for Oracle, RevID's a popular item of discussion. What would your comments be around if someone who's potentially considering that sort of transition, should they be waiting for something like that? Should they not wait? What are your thoughts on that?
No, I wouldn't wait. I don't know when you're looking at doing RevID, but I would not wait. I would go ahead and implement. Like I said, I would have implemented this far sooner had I known about this product. And my understanding is when you go to RevID, the product will be exactly the same from RevID. So you wouldn't have to do anything differently. You would already have that product. So I would not wait if I was going to RevID. And that timeline is different for everybody, but I would not wait, especially with a 3-month implementation.
Yeah, and you're exactly right. So the approach and the process that you teach your teams to do with RevID is exactly the same when you go into RevID. So it's a way to almost have some assurance there that you're still staying on top of this even after a transition like that, or to any new transition to another software product. Well, we're at about time right now. Stella, anything else before we start to wrap up?
We have a couple more questions. Let's see. How does this work in those areas, surgical or inpatient, that may take longer to get charges posted due to coding review intervention? And this is probably for Jessica, feel free to answer, but Charlie on our side can answer this as well.
I'll let Charlie answer it. I mean, see if we agree.
Yeah. So RevID, you can also build in what we call lag times. So this is important for the ED or surgical or some of your inpatient encounters where you need those lag times built in. I think lab even, especially if you're going to have a test where you're waiting on a result potentially before that charge drops. There are several different scenarios, and so the implementation team will work closely with the folks on how you charge, what the nuances to your department is, and ensure that those lag times or any other rules that you need are present by the time you go live. And then, of course, as Jessica mentioned, that's a continuing process with our client success team. So as new opportunities arise, the client success team is going to provide those rules and things for you on a go-forward basis. Anything to add to that, Jessica?
No, that sounds good. I mean, so you are able to customize how some of this needs to flow in and how you do that reconciliation. Whereas before, manually, you were trying to keep up with that or not keeping up with it.
Great. Charlie, looks like we have another question that came through for you. Is the process of developing exceptions a manual process, as in you have to configure every single exception using if-then statement in code, or is the development process dynamic using historical data to identify which charges should be associated with which procedures?
Yeah, that's a great question. So RevID works by taking the clinical extracts out of your EMR or other third-party systems, as I mentioned before, and then it's going to match that up with your posted charge file. RevID already has a historical built-in algorithm to catch these. Now, the reason why we do custom exceptions is because every facility is different. Every department is different. So there are exceptions that we do custom build. I wouldn't necessarily say it's an if-then statement, technically speaking, but we do build in those exceptions that are more in tune to that specific nuance of that department at that facility.
Great. Thank you, Charlie. That looks like it is it for questions.
Terrific. Well, Jessica, any final words that you would offer at this stage before we close?
No, I would just tell you that if you're serious about charge capture, this is a great product. I would highly encourage you to contact them and talk to them. It will give time back to your team, revenue cycle team, and your clinical teams, and you'll have a better outcome. You'll have a better product. You'll have an effective and efficient product around charge capture.
Thank you, Jessica. Really appreciate your insight and wisdom and your comments today and transparency and how you've been using the software. And as we said before, the impacts that Jessica and the CRISP team are experiencing are consistent with all of our RevID clients. Obviously, depending upon the magnitudes, the smaller hospitals are probably closer to a 5 to 6x return on investment, whereas the larger health systems are well over 10x return on investment using the software and the intangibles of improving gaining back time for people in critical key functions in the organization, and capturing some of the other intangible elements, including reducing late charges and rebilling. We thank you all very much for your participation today. We will be providing you a link to this webinar recording so that you can listen or share it with others in your organization if you'd like. You'll also be receiving a link to a short survey. We'd really encourage you to provide some feedback in the survey to help us understand how to better improve providing this information to you all. And finally, as a special thank you to all of the participants today, we are going to be performing a free analysis of your data to understand what the impact might be for your organization if you were to automate your reconciliation process. And we will be reaching out to you in the next 48 hours to schedule a time to run through with you what that potential impact might be. And last, both Charlie and I are going to be at the Oracle Health Summit at the end of the month and if you're planning to attend, please stop by and say hello to us. We're going to be wearing these orange lanyards so that we can really stand out there and make it easy to find us. Plus, it's almost Halloween, so orange seemed to be the right color to wear. But again, thank you to everyone for your participation, especially to Jessica for your kind participation. And have a great rest of the week, everybody.
Bye.
Thank you.